Uh, Shailendra, thank you for sharing all those details. Moving on to an important story that we have been tracking, the cough syrup row. The Directorate General of Health Services has issued an advisory warning against the use of cough syrups in young children after several children passed away in Madhya Pradesh and Maharashtra. Private doctors have been instructed to exercise caution. Any viral patient should not be treated privately but sent directly to the civil hospital. The Indian Medical Association has announced it will engage with the Union Health Ministry following the arrest of Dr. Praveen Soni, the physician linked to the controversial cough syrup linked to the death of 16 children in Madhya Pradesh. Well, joining us to take this conversation forward is Dr. Sushil Rathi, pediatrician and retired civil surgeon. Sir, thank you for being rather patient with us. But I'd like to understand from you, let's start from the grassroots itself. The fact that there were cough syrups that were out there, they have been prescribed to patients, to young children, and therefore we're unfortunately now looking at a loss of life of the young children. Now, we don't know whether it's linked to that or not. Those reports are not out, but would you say that this could have been resolved from the get-go had there been proper checks?
Yeah, the cough syrup which was supplied to the dealer and from manufacturer to dealer and to the retail shop, it has to be checked. The batch has to be checked because this cough syrup might be supplied for years, say 5-10 years. And the batch which contains the toxic substance as a diluent or preservative, it is usually not mentioned in the label of the syrup. So the doctor can't know that this syrup is toxic or not. Doctor used to prescribe in routine the drugs or the syrups or the tablets, and the tablet dispensed by the medicine shop is effective or of expiry or is toxic. A doctor can't know this. So it has to be investigated whether the death is because of the toxic substance, and who is responsible for it. It has to be investigated, and after the investigation proper action should be taken. The drug department, which used to regulate the drug to come in the market or used to for the sale, they should be responsible for this drug which is in the market.
Right, absolutely. I'd also like to understand from you, because the banned cough syrup Cold Riff had 48.6% of diethylene glycol. How toxic is that, number one? And number two, what is the kind of impact that it can have on a child's body?
That glycol which is toxic is usually at a higher percent, and it is used for the industrial use. And from where it comes to the manufacturer, and this drug or this toxic substance, it is excreted through kidney, and it used to damage the renal tissue. It can also damage the liver and other organs and the brain. So the toxic substance is harmful for the organs of a child, especially in the child, and it may lead to the death. So it has to be investigated by a committee of experts, especially medical experts, pharmaceutical experts, and other administrative experts, that who is the culprit behind this tragedy.
All right. I also want to understand from you, just to put perspective into context, put some context there. You've of course spoken about the problems, the toxicity of a higher concentration of diethylene glycol. But when we talk about it being in cough syrups, what is the percentage that is still okay for consumption?
That is 0.5 or 1%, that preservative or the antifreeze solvent should be there. So it is quite high percent if it is proved by the lab, and usually we not recommend the cough syrups in younger age group, or we recommend the safer drug for that younger age group. If such type of drugs are in the market, one should not prescribe, but it is sold on the counter as well as the other practitioners or even purchased by the uh, uh, parents directly from the counter and given to the child. So it has to be investigated and proper investigation probe should be done.
Absolutely. Now, if a child falls ill, worried parents are now expected to think twice before giving their children something as basic as a cough syrup. I'd like to understand from you, number one, and this is for human interest, what are the cough syrups that you would perhaps recommend to parents? And number two being, is it really important to prescribe a cough syrup to a child, or are there other ways in which something like a common cough and cold can be taken care of?
Yes, common cough and cold, it does not need any treatment. Actual में common cough and cold is subside by itself within 5 to 7 days. But sometimes the parents and they want that it should be it should be treated and doctor has to prescribe some drugs. The drugs should be safe and we don't prescribe the uh, cough syrup if when there is fever or some infection is there, then we used to prescribe. Otherwise, we don't prescribe even the antibiotics and the cough syrup. We used to prescribe the syrups only when there are symptoms and the child is severely ill.
All right, I think we've lost that connection over there with Dr. Sushil Rathi, but nonetheless, a big thank you to him for giving us the valuable insights and perhaps answering a lot of questions that parents have at this point in time. All right, we leave it there and shift our focus to some breaking news coming in. Former